Yeah, good evening, everybody. And it's once again a great pleasure to be a part of Hatvet series on webinar series on small animal gynecology. For the next couple of minutes, as I told you, I would be talking, next couple of hours, I'll be taking you through the four important topics, namely the unique features of the canine corpus luteum and how they are related to pregnancy and as far as medical termination of pregnancy and pseudo-pregnancy is concerned. I will also be taking you through the rules in medical termination of pregnancy, the protocols available for termination, and finally, I will be talking about strategies that are used to treat clinical pseudo-pregnancy in the case of dogs. So now this is a slide. As I said, I've always been giving you these slides in the previous sessions too. So dogs are very unique in that they have the longest estrus cycle when you compare to any other species. And each stage of the estrus cycle is also very long when you compare to any other species. Now, for the first few lectures, I've always been talking about the first two stages, namely proestrus and estrus. As I told you, it's time for me to move on to the next stage, which is going to be diestrus, okay? So now we need to understand that, again, as I said, there are so many peculiar features as far as diestrus or of pregnancy is concerned, which again is going to influence the protocols for termination of pregnancy as well as for treatment strategies for pseudopregnancy. Okay, so now this is a kind of a present representation of what normally can happen to a dog which is in heat. Okay, so let's say this is a dog which is in heat and there are two possibilities. I'm going to breed her or I don't breed her. If I don't breed this dog, then she may enter into a period of diestrus, which is going to be for 70 to 100 days. Now, if I breed this dog, there are again two possibilities. She could become pregnant and she could enter a period of pregnancy, which is 63 to 65 days, or she could be non-pregnant and enter into a diestrus period, which is going to be 70 to 90 days. So very obviously, you need to clearly understand the period of diestrum is longer than the period of pregnancy. I'll be telling you the reasons why, okay, later stages. So all dogs after pregnancy or after diestrus have to enter into a definite period of anestrum. So anestrum becomes a normal part of the estrus cycle, okay? And as I mentioned to you, anestrum does not include pregnancy or diestrus. It is the post-whelp or the post-diestrus period, okay? And this is, why I try to mention this to you is, this is different from an inter-estrus interval. Inter-estrus interval is the interval between two estrus periods. But this is actually what is a post-whelp or a post-diestrus period, which is going to be for 90 to 150 days, okay? And so, as I told you, dogs are very unique in as far as the diestrus or as far as the pregnancy is concerned. To make you understand better, now I'm going to try to talk about what normally happens in another species. And so I'm going to take the cow as an example. So this is the ovary and this is the follicle which is producing the egg. And also we have the hormone, that is estrogen, that's going to be produced. Now this estrogen is going to enter the blood circulation and this estrogen is responsible for estrus behavior in the cow, okay? So following estrus, this animal is going to ovulate. So once ovulation happens, now this egg is going to move from the site of fertilization, site of ovulation towards the site of fertilization, which is going to be the ampullary isthmic junction in the oviduct. So meanwhile, the sperms are also moving from the uterus. They're also moving towards the ampullary isthmic junction. So fertilization is going to take place in the oviduct. So meanwhile, what is happening to the site of ovulation is that after ovulation, there is going to be formation of a very important structure, which is going to be the corpus luteum. Okay. Now, this corpus luteum is a very palpable structure. I'm talking about a cow. Okay. Don't get confused with a dog. Right now, I have not come to the dog. In a cow, you have a corpus luteum, and this corpus luteum is producing progesterone. Okay. Now, in any species, including human being, you require a hormone to maintain the corpus luteum. So, as in the case of human beings, LH is supposed to be the major lutotrophic hormone in most of the other domestic animals. Now, LH is not only known as luteinizing hormone, it is not only responsible for ovulation, it is also responsible for maintenance of the corpus luteum. And that's why you call that as a luteolizing hormone or lutotrophic hormone. Okay. So now progesterone, what does progesterone do? So progesterone now acts on the endometrium. It causes hypertrophy of the endometrial glands. It increases uterine milk secretions, prevents the contractions of the uterus so that it keeps the uterus in a quiescent stage, okay? Thereby, it prepares the uterus to receive the fertilized ovum. Now, if the cow is not pregnant, see, cows are supposed to be polyestrous animals. That means they keep cycling every once in 21 days, okay? So if the cow is not pregnant, the corpus luteum has to regress, then only she may enter into the nest cycle, okay? So if the cow is not pregnant, then the uterus is going to synthesize PGF2 alpha, and prostaglandins then by countercurrent mechanism reach the ovaries where they bring about their regression. So that means you need to understand that the corpus luteum is going to be regressed by the prostaglandin released from the endometrium. Okay. Now, if the cow becomes pregnant, what happens is that the fetus is going to produce a substance which is called as interferon tau. Don't bother about that. But this interferon tau is a signal, or it is being produced from the fetus, and this acts as a signal for maternal recognition of pregnancy. So what this interferon tau is going to do is it prevents the synthesis of prostaglandins from the endometrium. So as a result, the corpus luteum is maintained until parturition is going to take place. So that means very clear, please understand, for any species a signal from the fetus is a very important aspect for the maintenance of the corpus luteum and then subsequently maintenance of pregnancy. Okay. Now, so how do dogs differ from this? Okay. The most important thing is that there is no pregnancy recognition system at all in the case of canines. So whether the dog is pregnant or non-pregnant, the corpus luteum is going to remain functional because again, there is no endogenous luteolytic mechanism to regress the corpus luteum. So that means there is no signal from the fetus, no PGF2 alpha that is going to be released from the uterus. So automatically the corpus luteum is going to remain functional both in pregnant as well as in non-pregnant dogs. So that means this CL is also producing progesterone, this CL is also producing progesterone. So that means progesterone is again going to be present both in pregnant and non-pregnant dogs. So that means I cannot use progesterone for pregnancy diagnosis in the case of canines. Okay, now I told that there is a hormone that is responsible for maintenance of the CL, and that is supposed to be LH in almost all the species, okay? So we say LH is lutotrophic in the case of canines, okay? But what's so, in other species, but what is so peculiar in the case of dogs is that up to 30 days, the corpus luteum is independent of lutotrophic support. It functions autonomously, okay? It does not require any hormone for its maintenance. So that means I cannot use any drug between before 30 days to regress the corpus luteum because it does not respond to any exogenous luteolytic agent. So that's again a clear understanding that you must have before I'm going to terminate a pregnancy. That means a corpus luteum is not responsive to any exogenous luteolytic agents before 30 days. It functions autonomously. It doesn't require any lutotrophic hormone at all. Okay. Now, after 30 days, prolactin is a major lutotrophic hormone in the case of canines, okay? Though LH does play a role in its maintenance, it's very, very minimal, but the major lutotrophic hormone is going to be prolactin, which is going to be produced from the pituitary gland. Okay, so that means I'm going to have prolactin both in pregnant as well as a non-pregnant dog. So that means again, I cannot use prolactin also for pregnancy diagnosis in the case of canines, okay? So very clearly, please understand, you have a prolactin. The prolactin in turn maintains the corpus luteum. The corpus luteum in turn produces progesterone. The progesterone in turn is going to bring about the changes in the endometrium to receive the fertilized ovum if pregnant. So if not pregnant also, the corpus luteum is there, progesterone is going to be there. So that's again very important. Okay. So we'll be talking about a little bit about peculiarities of the corpus luteum a little later also when I start with the term protocols. So diestress. So to kind of sum up what's happening in diestress, it begins with the refusal of the male. So it's a period following estrus period. It begins with the refusal of the male. And this duration, I said on an average, it can go anywhere between 60, 70 to 100 days. And the corpus luteum remain functional. There is no pregnancy recognition system at all. And all these non-pregnant dogs, all the non-pregnant dogs which are entering into diestress stage of the cycle, we call them as pseudo-pregnant. So pseudo-pregnancy is not a disease condition. The term pseudo-pregnancy does not refer to any disease condition. All non-pregnant dogs which are into the diestrous stage of the cycle, we refer to them as pseudo-pregnant. Okay.
Hatvet Pharma introduces Rajfan tablets, Fenbendazole 1000 mg, safest dewormer for pregnant animals, and a wonderful choice for rotation of deworming agents in your pet clients. Fenbendazole tablets 1000 mg, Rajfan tablets, antiparasitic systemic drug. Indications: anthelmintic for susceptible roundworms, hookworms, and tapeworms. Dosage for dogs and cats: 50 mg per kg for 3 consecutive days. Route: oral. Presentation: 1 into 3 tablets. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
And prolactin is a major lutotrophic hormone, and after 30 days. So after 30 days, the corpus luteum is independent of lutotrophic support. After 30, prolactin is the major lutotrophic hormone, and the CL is highly resistant to exogenous luteolytic agents. And in non-pregnant dog, the regression of the CL is only brought about by aging. See, in a pregnant dog, what happens is the dog has to deliver by 63 to 65 days. So in that situation, the corpus luteum has to regress. So where is the source of prostaglandin? It's coming from the placenta. The placenta is producing prostaglandin, and then this placenta will go and regress the corpus luteum. But in a non-pregnant dog, I don't have any endogenous luteolytic agent. So as a result, the regression of the corpus luteum happens because of aging. And that is why the diestress period is longer than the pregnancy period. Okay. So let's go on to mismating and medical termination of pregnancy. Okay. So once again, Doc, is there any way that you can remove this top one?
Yeah. Which one, ma'am?
The top, I am getting all this. Okay, don't worry. So
Okay.
you have a Labrador bitch named Sparky. She was in heat for the past 1 week, and she's presented within 24 hours after an alleged mismating for treatment, as the owners did not want the bitch to have any puppies. So the owners are frantic. They say they've they suspect a mismating to have happened 24 hours before, and they don't want the bitch to have any puppies. Okay, so the first thing is you need to understand, why did such a situation arise? Okay, normally unwanted pregnancy arises because owners are not aware the pets are in heat, or they may be aware that the dog is in heat, but they underestimate the will of the bitch and the stud to encounter each other. I have a lot of clients who come at, who suspect a pregnancy. They won't have actually bred the dog. They suspect a pregnancy somewhere around, 35 or 40 days. They find that the mild distension of the abdomen, and they suspect a pregnancy. And when I ask them, is there a possibility of any mismating to happen? They say 100%. There is no chance, ma'am. I have a very big compound wall, but you will not believe it, the dog would be pregnant. So that's why I said, never underestimate the will of the stud or the bitch to encounter each other. So this is one of the most common reasons for a misalliance or mismating or unwanted pregnancy to happen. Okay. So now, what question would I ask this case? Okay. So the first thing is, I would say, how long was this dog gone? Okay. So how long was she gone before? So now, this is very important because, you need to think whether the time that she has gone, would there be a possibility for a breeding to have taken place? So normally you take at least 30 days 30 minutes for a mating to happen. Okay. But if she's just gone for 5 minutes or so, then the chances are very, very little, right? Okay. I'm not saying it's nil, but then the chances are very little. So I would probably ask them. Now, why I ask these questions is, a lot of times, the clients, when they come to you, there are three categories. One would have actually seen the mismating taking place. So he says, ma'am, I saw a lock, I saw a tie, and then I saw the mating happening. Now, there's another category who says, no, my dog just ran out and she came back after some time. Okay. And there's a third category which says, I saw the male and the female together, but I didn't see them actually mating. So now these three categories are there. So that's the reason why I asked them, how long she was gone, is there a possibility for a mismating to have taken place? Okay, so once I get this, now how do you approach this case? Okay, for this you need to answer a couple of questions. Should I start with estrogen therapy? Okay, or can I avoid a blind therapy with estrogens? Okay, it's called as blind therapy or blanket therapy. Blanket therapy means I don't even know whether the dog has been mated or not, but I still am going to go ahead with treatment with estrogen. So can I avoid this blind therapy with estrogen? Are there any ways to confirm or not whether the bitch has been mated with a stray dog? And the third thing is fourth thing is what are the chances that she would conceive? So I'll try to answer all these questions. So I'll try to address each one of this separately. Okay, should I start with estrogen therapy immediately? So before I say yes or no, let's look at how estrogens work, right? Now, estrogens cause what is called as tubal locking. They close the junction between the uterus and the oviduct. See, please remember, he's bringing this case to you only after 24 hours or probably sometimes 1 day later, 2 days later, where by that time the sperms would have already reached the site of fertilization. So your estrogen is not going to prevent fertilization from taking place, but what it does, it closes the uterotubal junction so that the fertilized ovum is not able to enter into the uterus. Okay, so that's one thing. And even if the fertilized ovum enters into the uterus, now the contractions brought about by estrogen is going to prevent nidation or implantation from taking place. Okay, and also estrogens also have what is called as a direct embryotoxic effect also. Okay, so now generally what happens is, this is basically how they function. Okay, so now you need to know whether estrogens are safe or not. Okay, so here you need to know that these estrogens are known to produce dose related, often irreversible bone marrow suppression. Okay, now some doses which is I mean a dose which is going to be therapeutic for one particular dog may be toxic for another dog. Okay, so for example, if I'm using 7 milligram for one dog, that same 7 milligram may become toxic to other dog and may lead to severe anemia, thrombocytopenia, and even death. Okay, and estrogen preparations are going to increase. Estrogens always potentiate the action of progesterone, and progesterones are responsible for development of pyometra. So that means estrogens may induce or increase the incidence of pyometra in the bitch. And they also cause a prolongation in the heat period. So there's always a possibility for the dog to get mated once again. So you need to understand that before I administer estrogen, the potential adverse effects need to be considered before choosing this as a treatment option. So if you ask me, I would say no to estrogen therapy. Okay, I never use estrogens at all. So, but still, I'm trying to address this because this is a talk on on misalliance and medical termination. Okay. So now the second question and the third question are going to be answered with the same thing. Can blind therapy with estrogens be avoided? Or are there any ways to confirm whether or not the bitch has been mated with a stray dog? Okay. So that means I don't want to blindly go for a therapy. I want to make sure that the dog has actually gone for a mismating or she has been mismated. So what we do is, I can go and check for the presence of sperms in the vaginal passage. So now I use what is called as a cotton swab technique or an aspiration technique. The same way I take a vaginal smear, I'm going to introduce it into the vagina, do one rotation clockwise, one rotation anti-clockwise, take it out. You have a small centrifuge tube, have a few drops of saline into it. Just dip this cotton bud into it. Then just transfer the drop onto your slide, put a cover slip, examine for the presence of sperms. You can see the sperms beautifully. Now this is a similar image where you can actually see the sperms are all visible here, right? Okay. Now the other way is you can do what is called as an aspiration technique. Aspiration is where I'm actually introducing a sheath, infuse some amount of saline, transfer it into a centrifuge tube, and then what you do is centrifuge it, and the sediment you actually transfer it onto your slide, and either you just tilt the slide so that the drop rolls down, you stain it, examine it, or just put a cover slip over the drop and examine it. So this is basically, you will be able to visualize both the cells as well as the sperms in your the swab or in the aspiration technique. Okay. So now the presence of sperms are 100% indicative that a mismating has happened. But please remember, an absence of sperms does not rule out a mating. Now I'll be able to visualize these sperms for at least nearly 72 hours. Okay. So at least for a period of 3 days. Now, when somebody comes to you 4 days or 5 days or 10 days after mismating, then it's not possible for you to look for the presence of sperms. Okay. So now what are the chances that she would conceive, right? Now, how do I check the chances of her conception? Okay. Now, the presence of sperms in the vagina, plus I would do what is called as a serum or plasma progesterone concentration estimation. And if the levels are intermediate to high, and then based on cytology, if I know that the dog is in estrus, then the risk of conception or the chances of conception are going to be very high. Okay. But knowing whether the risk of conception is going to be high or not is going to be irrelevant to me. So because if I am not going to do anything right now, anyways, I would be asking the owner to come at 30 days and I would check for a pregnancy. And if pregnant, I would go for medical termination of pregnancy. Okay. So that means this doesn't really matter. But again, from what do you call that, a scientific perspective, this is also going to add to your information as to whether the chances of a conception are high. Okay. Now, believe me, almost 99.9% of so-called mismating cases are proved to be positive. Okay. Books generally, tell you that it's around 65%, but if a mating has happened, 99.9%, believe me, they're always positive. In my experience, I've only seen one case where with a mismating happening, that dog did not become pregnant. When we collected the vaginal cytology smears, we saw along with the cell types, we also saw what is called as multinucleated giant cells, which was a clear indicator. The multinucleated giant cells come from the semen, okay? And so that means this dog was having a testicular degeneration. And so there were no sperms present, but lots of multinucleated giant cells, indicating this male was infertile. Okay. So anyway, what we told the owner is, yeah, I'm 99% sure this dog is not going to conceive, but please, there is always a 0.1% chance. So please come back on 30 days for an ultrasonography to check for pregnancy. So this is, you need to clearly understand that. Okay.
Hatvet Pharma introduces Hatclaf DS Serum, amoxicillin 400 mg, potassium chlorate 57 mg per 5 ml, bacterial aminopenicillin with beta-lactamase inhibitor with extended spectrum of antibacterial activity, amoxicillin and potassium chlorate oral suspension, Hatclaf DS, potentiated aminopenicillin systemic drug. Indications: broad spectrum antibiotic for bacterial infections, skin, soft tissue and UTI infections. Dosage for dogs: 13.75 mg per kg for every 12 hours. For cats, 62.5 mg per cat every 12 hours. Route: oral. Presentation: 30 ml. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
So now, having answered all these questions, okay, my approach to this case will be no to estrogen therapy. I would never use estrogens because, as I told you, the adverse effects of estrogens are so many. So I prefer to go for a medical termination of pregnancy. Now, but how do I do this? At what stage could I do this? Okay, now my estrogen was preventing implantation, but now what can I do? What is the next approach to my case? Okay, so for this, you need to know there are 3 stages in the case of canine pregnancy. Stage 1 is from fertilization to implantation, where implantation is going to happen between day 20 to 22. Okay. Yeah. So day 20 to 22. And the second stage is from implantation to ossification, where it is going to happen between day 22 to day 42. And the third stage, which is from ossification to parturition, which is happening from day 42 to 65. Okay. So which is going to happen from day 42 to 65. So now the question is when to terminate a pregnancy. So now what happens is the best time to terminate a pregnancy is in stage 2, that is between 22 to 42 days, where I would be actually seeing what is called as, one second, doctor. Yeah, where I would actually be when I'm doing the stage 2, which is between implantation to ossification, which happens between day 22 to 42 days. So this is the best time to terminate a pregnancy, because all terminations result mostly in case of resorptions rather than fetal expulsion. Now, this is going to be less traumatic to the owner. Now, just imagine if the dog comes to you after 42 days and you're trying to terminate a pregnancy and you have live fetuses coming out. Now, that is the reason why we always choose this stage, that is stage 2, which is the best time to terminate a pregnancy, between 22 to 42. In fact, up after 30 would be an ideal point to start your termination protocols. Okay, so that's why this is to answer when to terminate is stage 2 is the best time to terminate a pregnancy. Okay, so now there are certain rules or general considerations which you need to remember when I'm going to terminate a pregnancy. Now, the first rule is that these pregnancy termination drugs are effective only after day 30 and not before that. Okay, so that's the first rule. So the corpus luteum of bitches are highly resistant to leucolytic agents. So up to 30 days, they will not respond to any leucolytic agents. Now after 30 days, they will respond, but even then the resistance is very high. So any leucolytic agent that I'm going to give, it needs to be repeatedly administered, okay, for it to bring about the regression of the corpus luteum. So repeated administration several times a day is an absolute requirement as far as termination is concerned. And most important thing is you need to understand that you require only 2 nanograms per ml of progesterone to maintain pregnancy. But in the case of canine, you have nearly 50 to 80 nanograms. So when I'm giving all these termination drugs, what is happening is the progesterone level comes down to less than 2 and fetal expulsion will start. Okay. But what happens is if I'm going to discontinue the treatment halfway through, the progesterone levels can go back to normal and pregnancy can be maintained. Okay. So that is the reason why we always say rule number 4 is that always you need to go on giving the drug until all the fetuses are expelled or absorbed. Okay. So that means until verification by an ultrasonography. This is because partial resorption of a litter can occur if the treatment is discontinued prematurely. Okay. So with these rules, let us look at your treatment plan. What will you do with this particular case? See, I said no to estrogen therapy. So now what do? I don't have anything. I can't do anything at all. So I will ask the owner, don't worry, please go back. Come after 30 days for an ultrasound to check for pregnancy. And if she's pregnant, then I will go for medical termination of pregnancy. Okay. So my choice of protocol, okay, depends upon what protocol I'm going to choose. That's also important. And then as I'm going to terminate a pregnancy, I'm also going to monitor the efficacy of the medical termination. Okay. So now the first thing is my diagnosis of pregnancy. Okay. So remember, I'm asking the owner to come at 30 days for an ultrasound to check for pregnancy. Okay. Imagine that you don't have an ultrasound with you. You don't have an ultrasound at all. So now the first question is, how will you diagnose a pregnancy at 30 days? I told you abdominal palpation. It's not a foolproof method. Okay. So relaxin is not available with us. Radiography cannot be done at early stages. It is only late pregnancy diagnosis. So that means how will I diagnose a pregnancy? Okay. So that means if I don't have an ultrasound, I'm not able to diagnose a pregnancy. Chalo, let's assume the dog is pregnant, right? Let's assume the dog is pregnant but you have not done a diagnosis and you start a termination protocol. Okay. Now, what does the rule say? You have to go on giving the drug until all the fetuses are absorbed, expelled or absorbed. So that means, first of all, you don't know how many are there. So you don't even know how many will start to get expelled. Let's say I'm giving a drug for 5 days and then the 6th day the dog starts to abort. Okay. Now, how long to go on giving this drug? You don't even know, because there are situations where terminations have gone even up to 14 days for all the fetus to be expelled, right? Okay. So when to stop the treatment, you don't know. So that is why we say ultrasonography becomes an integral part of your termination protocol. I needed to diagnose a pregnancy. I also needed to monitor the efficacy of my termination. Okay. Now this you need to clearly understand. Okay. So let's assume that you've diagnosed a pregnancy, you've done an ultrasound, you diagnosed a pregnancy, and now let's go for termination, your choice of termination protocols. Okay. So the first one is, okay. So here, there is the prolactin there, and this prolactin is going to act on the corpus luteum. The corpus luteum in turn produces progesterone. The progesterone in turn is going to help maintaining pregnancy. So now what I'm going to do here is that I can cut off the prolactin support by going for anti-prolactin drugs. So examples of anti-prolactin drugs are bromocriptine, cabergoline, and methacholine. Okay. Now this is one approach. Now the second approach is I can bring about the regression of the corpus luteum by going for leucolytic agents such as prostaglandins. Okay. Now my third approach is going to go for antiprogestins. So what is antiprogestins? Antiprogestins are they don't prevent synthesis of progesterone, but what they do is they go and bind to receptor sites, so they prevent the action of progesterone. So classical examples of antiprogestins are mifepristone and aglipristone. So in all these approaches, either I can go for an antiprolactin drug, or I can regress the corpus luteum by going for a leucolytic agent, or I can cut off the progesterone by going for antiprogestins. In any of the situation, what happens is there is going to be the progesterone is going to be affected. As a result, pregnancy is going to be terminated. So let's look at the first treatment protocol or first medical, termination protocol. That's by the use of antiprolactin drugs. Okay. So as the name indicates, antiprolactin drugs, they prevent the synthesis of prolactin or suppress prolactin secretion. Okay, by endogenous dopamine released from the hypothalamus. So basically, these antiprolactin drugs are supposed to be dopamine agonists. Okay, that means if there is going to be dopamine, prolactin is going to decrease, automatically progesterone is going to be suppressed. So as I told you, bromocriptine and gabagoline, they have a very strong D2 receptor activity, and they are excellent drugs for treatment of or medical termination of pregnancy, antiprolactin drugs. Okay. So now bromocriptine. So normally it has I told you it's an excellent D2 receptor activity, but the problem with bromocriptine is that it has severe side effects. See, initially when we started working with medical termination protocols, I'm talking about way back, right? Years ago. So bromocriptine was the first, that was the only choice of treatment for medical termination. Okay. So this or prostaglandin. So when we started using bromocriptine, what we realized is that severe vomition, anorexia, depression, okay, was there. And this was like, this basically because the ED50 for emesis is the same as that of the therapeutic dose. That means 10 micrograms I'll be vomiting, 40 micrograms more vomiting, 100 micrograms I'll be severe emesis will be there. And most often the owners would say, no, doctor, I don't want to use this treatment. I want to stop the treatment. So it's kind of, it was never too successful. Now this emesis is because of interaction with the dopaminergic elements in the emesis center of the brain and the ability of the drug to cross the blood-brain barrier. So this is why the emetic effect is more in the case of bromocriptine. Okay. And again, as I told you, the dose is going to be 100 microgram per kg body weight. The rule is that you need to give it for a minimum of 4 to 5 days. Nothing happens before that. Okay. I told you it is very difficult to regress the CL. So nothing is going to happen before that. So minimum of 4 to 5 days, I'm going to go on giving the drug until all the fetuses are expelled or absorbed. But once again, because of the side effects, I would say no to bromocriptine. So now the other alternative is going to go for gabagoline. Okay. Now, once gabagoline came, I think that's an amazing drug. It has so many applications as far as canine reproduction is concerned. And one of the major applications is medical termination. Okay. Now, this is a more potent dopamine agonist than a bromocriptine. And the ED50 for emesis is 4 times the therapeutic dose. Okay. That means if I'm going to only exceed 4 times the dose, then only it results in vomition. Okay. So it is very effective in minimal doses and it has very, very little side effects. And basically I started at after 30 days and the dose is usually 5 microgram per kg body weight. BID, once again, remember all termination protocols are BID protocols. So blindly, it's a BID protocol for a minimum of 5 days, but until I have to go on giving the drug until all the fetuses are expelled or absorbed. Okay. A minimal or no side effects, and it's a more specific D2 dopamine receptor agonist, and it is less able to cross the blood-brain barrier and have CNS effects. Okay, so that means compared to bromocriptine or gabagoline is your choice of the treatment for termination. Now, the third option is to go for serotonin, okay, agonist, which is nothing but a classical example is going to be metergoline. But this is currently not available in India. But again, this also stimulates endogenous dopamine secretion and thereby inhibiting prolactin secretion. Okay. But currently this is not available in India. So let's not talk about this basically. Okay. So the second option is to go for regression of the corpus luteum. So I said, when I'm going to regress the corpus luteum, I'm going to directly go for a luteinizing agent, namely prostaglandins. Okay. So how do prostaglandins bring about the regression? So basically they bring about regression by vasoconstriction. They constrict the blood vessels, that blood supply that goes to the corpus luteum. So there is a reduced blood supply, cellular degeneration happens, and this also interferes with your progesterone synthesis. Simultaneously, there's going to be an increase in myometrial tone and myometrial contractions. So prostaglandins bring about regression of the corpus luteum, then contractions of the uterus, and dilatation of the cervix. So this is the order of its action: regression of the corpus luteum, contractions of the uterus, and dilatation of the cervix. Okay.
Hatvet Pharma introduces Rajfan 50 syrup, Fenbendazole 50 mg per ml, the perfect dewormer for your pet. Fenbendazole oral suspension 50 mg per ml, Rajfan 50 syrup, antiparasitic systemic drug. Indications: anti-emetic for susceptible roundworms, hookworms and tapeworms. Dose: for dogs and cats, 50 mg per kg for 3 consecutive days. Route: oral. Presentation: 60 ml. You can book your order online at www.hatvet.com. Thank you.
So now basically I have two protocols for prostaglandins. One is what is called as a high dose protocol, and another one which is called as a low dose protocol, or you can also go for cloprostanol, which is nothing but a prostaglandin analog. Okay. Now, as far as natural prostaglandins are concerned, I told you have a high dose and a low dose. The high dose is 0.1 to 0.25 milligram per kg body weight. Once again, remember, BID. For a minimum of 4 to 5 days, you have to go on giving the drug until all the fetuses are expelled. So normally, I use the 0.25 milligram dose. Okay, so I use the 0.25 milligram per kg body weight dose, and I give it for a minimum, as I told you, for 4 to 7 days. I keep doing it. Okay. Now, a lot of people are scared because prostaglandins not only act on the corpus luteum, it acts on all the smooth muscles of the body. So you have a lot of side effects associated with prostaglandins. So people are scared to go for a higher dose. So if you're scared to go for a higher dose, go for the low dose PGF2 alpha, which is going to be 20 to 30 microgram per kg. And you can go for a BID or a TID. So remember, as you decrease the dose, the frequency of administration should be increased. Okay. So most often it becomes a TID protocol, right? Okay. Now you see very, very little side effects with your low dose protocol. So, but both are going to be effective and the time duration is going to be the same. Okay. Now the other option is to go for cloprostanol or an analog. Okay. Now, when we started working with termination protocols way back, as I said again, initially, we had only natural preparation, that is luteinized, right? So we did have cloprostanol, but we were scared to use cloprostanol because generally we assume that analogs are more potent than your natural preparation. So that means the side effects will be very, very heavy with an analog. That's how we thought so, okay? But so that means we were very scared to use the analog. We were always going for the natural preparation. But after a point, what we realized that when luteinized, there was a shortage of this natural PGF2 alpha, we were forced to go for cloprostanol, and we realized that the side effects were very minimal when we used proprostanol. This is because this cloprostanol has a greater affinity toward the CL than to the smooth muscle receptor. So that means the action was much better and the side effects were less. I'll talk about this later. So I prefer to go for cloprostanol at the rate of 2.5 to 5 micrograms. I prefer to use the 5 microgram per kg once a day. Now this is where this is different. All termination protocols are BID except cloprostanol, which is once a day protocol, because it has a longer half-life, okay? Or I can administer it every 48 hours and start it after day 30, and the termination goes on for 4 days or even longer, okay? So minimum 4 to 5 days, don't expect anything to happen in any of these protocols when they're used individually, right? I prefer the 5 microgram per kg body weight protocol and once a day. And this is an excellent drug of choice, okay? So Now, as I told you, prostaglandins not only act on uterine muscles, not only act on the corpus luteum, they act on all the smooth muscles of the body. So you'll have side effects such as panting, defecation, urination, salivation, tachycardia, restlessness, everything will be there immediately following your PG administration. Okay. So that means you need to understand that these side effects, none of the side effects are lethal, right? But provided you follow the rules, you're not supposed to administer prostaglandin when the dog is having cardiac or respiratory problems. Okay, so that's one thing. One of the rules of not to use prostaglandins. And second thing is, don't use prostaglandins in older dogs. Okay, so if I want to reduce the intensity of the side effects, I can go for an administration of atropine 15 minutes prior to my PG administration. Okay, so now as I told you, don't worry, we have given a PG for thousands of dogs. Absolutely, till now there is no lethal effect at all. Okay, till now we have never seen a death. Okay, because this most important thing is you need to follow the protocol, right? And though there are side effects, these side effects are only transient, short-lived. Okay, and they're dose dependent side effects. If I take a smaller dose, lesser the dose, the side effects are going to be lesser, and I'm going to increase the dose, it's going to be higher. So the other alternative for you to start off with a lower dose and then gradually increase the dose as it goes. Okay, because now for with each administration, the side effects are going to be less severe. So by third or fourth day, the dog gets used to your the prostaglandin injections, and there will be very minimal side effects. Now, since the half-life of this natural PGF-2 alpha is only seconds, you need to administer multiple times. It's an absolute requirement. And so as I told you, maximum you have seen 14 days, right? Okay, for a termination to happen. Most often it is successful within 5 to 7 days itself, right? Now I said why cloprostanol. As I told you, it has a greater affinity towards the corpus luteum receptors than to the smooth muscle receptors. So less amount of side effects, but better effect. They have a half-life of 12 to 14 hours. So that means they have a longer duration of action. So that means a single administration with cloprostanol is enough, right? And it has a stronger neutralizing effect. So that means at lower doses I can use. Now, only word of caution is when you use a PGF2 alpha, please check whether it is a natural preparation or an analog. Remember, if it is an analog and if I'm going to use it at the dose rate recommended for a natural PGF2 alpha, believe me, you're going to have a dead dog on the table. So it could be extremely fatal. So when you're giving prostaglandins, don't worry, don't get scared, nothing at all, because a lot of people stay back for administration of PG for the simple reason of the side effects. Don't worry about this. Just make sure that you follow the dose for the appropriate prostaglandin that you're going to use. Okay. Now, the third option is to go for antiprogestins such as mifepristone and aglipristone. And in both these situations, so now what happens is, what do these antiprogestins do is, these antiprogestins will go and bind to the progesterone receptor. See, for any hormone to act, it requires a receptor, right? So now what this mifepristone will do is, they go and bind to the receptor. So that means they will, though progesterone is there, there is no action at all, right? And it's efficient from 0 to 45 days of pregnancy. But still again, for a termination to be more effective, I would start it again from from after 30 days, right? And so here, as I told you, the drug of choice is going to be mifepristone, mefeprin, commercially available as mefeprin. It's Ru486. And the dose is going to be 2.5 milligram per kg. BID, again, the BID protocol does not stop here. BID per os for 4.5 days, 4.5 to 5 days, starting from day 32 of pregnancy. Okay. Now, this is where there's something different as far as, the protocols are saying. I said just 4.5 days only. Because all of the protocols I was telling you, you have to go on giving the drug until all the fetuses are expelled out, right? So here, when we saw 4.5 days, we were so happy with this termination because I can now suggest this to any practicing veterinarian without an ultrasound, because you just have to give it for 4.5 days and then you stop the treatment and there will be 100% efficacy. But this did not happen. What we realized that in case of stray dogs, right? In fact, in most of the stray dogs, this 4.5 treatment schedule was not at all enough. So here too, how did we realize that at 4.5 days termination was complete? That's because of your ultrasonography. We realized that a lot of fetuses were viable. So here also what we do is we start the treatment, we give it for 4.5 days, but we also combine mifepristone with other drugs. Okay, I'll talk about this in the next slide. Now the other option is to go for aglapristone, alizane, which is not commercially available in India. It's available in European countries, though marketed by Burback, it's not available in India. And here again, the advantage is that it's a 10 milligram per kg dose, and you just have to go for 2 injections at intervals of 24 hours after 26 or 45 days of mating. So in all these cases, resorption, most often because you're starting at 32 days, the most important thing is there is resorption rather than fetal expulsion, which is extremely great for a practicing veterinarian, right? Okay, with absolutely no side effects. Okay. Now, the only disadvantage with the mifepristone is the cost of the drug, okay? So let's assume that you have a 9 kg body weight dog, right? I told you the dose is going to be 2.5 milligram per kg, so that means 22.5 BID for 4.5 days. That means I require 9 doses, totally 9 doses I require. Now, the presentation is 200 milligram tablet. So that means if I'm going to divide this 200 divided by 22.5, this one tablet will be sufficient for a 9 kg body weight. So that means the price is going to be 400 per tablet, right? But for a 25 kg body weight, imagine what's going to happen. I require 3 tablets. So the cost of my termination is going to increase, right? When I'm going to include a mifepristone into my treatment protocol. So this again, please keep in mind when you're trying to suggest a treatment or a termination protocol for your client. Okay. So as I told you now, I have 3 drugs. You have antiprolactin drugs, you have luteolytic agents, you have antiprogestins. Individually, they can be used. They bring about excellent effect. Okay. And the termination protocol duration can go anywhere between 4 to 7 days or sometimes max 11 to 14 days. Max. Okay. But I can also go for combination of these therapies. Okay. Now I can go for a combination of antiprolactin plus luteolytic, antiprolactin or antiprogestins, or PG plus antiprogestins. Any combination I can go for. Okay. See, the actions are different. Each one of them are going to act differently. But ultimately what they do is they are going to affect the progesterone secretion. As a result, pregnancy is going to be terminated. So my combination protocols help in actually reducing the time taken for the fetal expulsion to happen, absorption or expulsion to happen. So sometimes what I do is I go for all 3 protocols together. Okay. I just don't have to do 2. I go for even 3 protocols. Again, that's what I said. Again, it depends upon the affordability of the owner. So my choice of my protocol, my treatment, which protocol to use depends again on the affordability of the owner and how long he has to travel. See, for example, the first thing I would ask him is, where are you coming from? Suppose he says, I'm coming from a very long distance. Imagine he's going to take an auto. How does he come? If he's going to come by an auto or he's going to take a cab. So the expense he's going to pay for a cab, he might as well pay for mifepristone. So there again, that's what I said. Please choose your protocol in a wise manner. So whereas somebody who stays very nearby or has his own car or he can afford to come, then I would go for a combination of the cloprostenol plus cabergoline. Cabergoline is very cheap. So here again, my choice of my protocol depends. Now, if the owner can afford go for all 3 protocols because this really markedly reduces the time taken for fetal expulsion. Now, I can also introduce another drug which is called as misoprostol, okay, which is commercially available as Misoprost. And the dose is 400 microgram. It's available as a 200 microgram tablet. And you need to go for 2 tablets, place it intravaginally and repeat it after 48 hours. Okay. This is excellent because what misoprostol is, it's a prostaglandin E. What misoprostol do is it goes and binds to the PG receptors and the myometrium, brings about uterine contractions as well as cervical ripening. So that means it's also going to facilitate the termination. And we have seen termination happening within 3 days itself.
Hatvet PHARMA introduces Hatclaf 375 tablets, amoxicillin 250 mg plus potassium clovonate 125 mg, potentiated aminopenicillin systemic drug, bactericidal aminopenicillin with beta-lactamase inhibitor with extended spectrum of antibacterial activity. Amoxicillin and potassium clonate tablets. Indications: for treatment of urinary tracts, skin, and soft tissue infections caused by susceptible organisms, particularly gram-positive bacteria and anaerobes. Indicated for canine periodontal disease due to susceptible strains of bacteria and for treatment of bacterial respiratory tract infections. Dosage: for dogs 13.75 mg per kg, for cats 62.5 mg per cat, every 12 hours for 5 to 7 days or 48 hours. Route: oral. Presentation: 1 into 10 tablets. You can book your order online at www.hatvet.com. Looking forward to a long-lasting business association. Thank you.
So an inclusion of a misoprostol protocol into your other drugs, okay? See, this is not the basic termination drug, right? The basic termination drugs are either going to be your antiprolactin drug, leucolytic drugs, or antiprogestins. But when you combine them with your misoprostol, prostaglandin E, the effect is much better because PGE can help in relaxation of the cervix, and thereby it helps in resorption or expulsion happen within 3 days. In fact, for some people who come to me at a later stage of pregnancy, at 40 days, 45 days, I have done termination at 45 days also. I would not advise it to you, but I've also done terminations at 45 days because sometimes that's when the owner realizes that his dog is pregnant. Till then, he never even knows that his dog is pregnant. And I've gone for termination even at 45 days. And those situations, I would tell to the owner, I do not know how successful my termination protocols will be. You will be seeing sometimes live fetuses coming out. There is always a possibility that some fetus could be expelled and 1 or 2 can go to term. Okay. With all this, I may start with protocol, but 100% I will go for all the drugs. All 4 drugs together, I would go if the gestation is going to be in more advanced stage. Okay. That means, but beyond 48 days, I've never done any treatment protocols at all. I've never done inductions. There was just 2 cases where I've done it at 46 or 47 days. Beyond that, I've never gone for any terminations. Okay. So the most important thing is you need to monitor your efficacy of your treatment using an ultrasonography. Okay. So that means so what I do is I start a protocol up to 4 to 5 days. I just go on giving the protocol. I will not do an ultrasound. Now on the 5th day, I will then look for an ultrasound. Thereafter, every day or every alternate days, I will do an ultrasound just to see the efficacy of my treatment. Once I see all the fetuses are expelled, I will stop the treatment. Okay. So that means that is indicated that your termination is complete and you can stop your treatment protocol. Okay. So the other drugs which are not, I would not suggest them to you, but again, since this topic is there, and I know there will be some questions that would come up with this, corticosteroids, can we use corticosteroids? Yes, there are, reports on the use of corticosteroids, but the results are not consistent. That is the reason why when I tell somebody who comes to me with a mismating happening, and I would tell the owner that don't worry right now, you please come after 30 days, I will take care of it. I will 100% go for a termination protocol. I'll make sure that my drug that I choose will terminate the pregnancy. Okay. So when corticosteroids have a history of not being 100% effective, I would not suggest it, but still there is a protocol where you can go for a decreasing dose. Okay, that 200 goes, you can go on by 7th day, I gradually decrease the dose. Okay, so the outcome of abortion or resorption can happen within 7 to 13 days. And as I told you, side effects with corticosteroids are polyuria, polydipsia, and most important, you need to actually look for a constant monitoring with an ultrasonography. Okay, now other drugs which are available, which are also, which I can use for termination, but are not currently available in India. The first one is epostain. See, now there is a big window after mismating. If I say no to estrogen therapy, then I have no alternative up to 30 days, right? Now only after 30 days I can confirm a pregnancy and start a termination protocol, right? So in between this, there is a drug we can use which is called as epostain, right? that epostatin prevents the conversion of pregnenolone to progesterone. So that means I don't have an active form of progesterone to maintain a pregnancy. As a result, the pregnancy gets terminated. Okay. But unfortunately, this drug is not available, epostatin. Okay. This is another drug. And GnRH antagonist, they prevent the GnRH activity. So when GnRH is not going to be there, LH is also not going to be there. And it also helps in disruption of the pregnancy. Okay. So here again, these are drugs that are not commercially available in India, or there is no patented drug for GnRH antagonist till now. Okay. So the best choice of your termination protocols are going for antiprolactin drugs, antiprogestins, and leucolytic agents such as prostaglandins. Okay. So now we go on to the second topic, which is just going to be a few minutes. I will take. So this is canine pseudopregnancy and its treatment strategies. Okay. So basically, when you're talking about pseudopregnancy, I use the word overt pseudopregnancy. I hope you remember I told you all dogs which are non-pregnant, which are in the diestrous stage of the cycle, we call them as pseudopregnant. So the word pseudopregnancy does not indicate the disease condition. Okay, we always call that as an overt pseudopregnancy. Or in other words, I use the word clinical pseudopregnancy. So dogs which show signs are referred to as clinically pseudopregnant dogs. Okay. So when this overt pseudopregnancy, the other names are common synonyms are pseudopregnancy, pseudocysis, false pregnancy, or nervous lactation. Okay. Now, why does this happen in dogs? Now, this is actually an evolutionary adaptation. So way back, what happened is, like, initially when dogs move in packs, the alpha females, normally what they do is when they deliver the puppies, they would not be taking care of the pups. It's usually being taken care of by the other non-pregnant females. So what they do is when one female is there, the other non-pregnant females, which are the diestrous, they may lactate, and they will help in nursing or bringing up these puppies. Okay, so this is actually basically an evolutionary adaptation. Now the incidence is 50 to 75% and may occur 3 to 14 weeks after the estrus period. Please understand this. Okay, so usually the pseudopregnancy follows the diestrus period, right? It does not happen during estrus period. It usually follows the diestrus period. Please understand that. Okay, so to understand better what happens in pseudopregnancy and how I'm going to interfere with this treatment protocol. Okay, now you need to clearly understand what is happening in a pregnant dog, right? So this is the estrogen which increases, and mid-proestrus it starts to decrease, comes to basal level, and progesterone is starting to increase at proestrus itself. So I'm not going to talk about this because I've already dealt with it in the first two lectures. Okay, so the progesterone is going to increase. It goes on increasing, right? Okay, so throughout the period of pregnancy, it goes on increasing. Now around day 30, there is going to be a decline in progesterone, but it comes to basal level with the onset of parturition. So throughout pregnancy, I'm going to have progesterone, but what happens is around day 30, there is a decline, but it comes to basal level only with the onset of parturition. Okay. So you need to understand, I require only 2 nanograms, but here I'm having nearly 50 to 80 nanograms. So this decline is not going to affect the pregnancy at all. Now, around this day 30, there is going to be an increase in prolactin. So why do I require this prolactin? I told you prolactin is required for the maintenance of corpus luteum after day 30. So this prolactin is going to be, it comes from the pituitary, and it is actually helping in maintenance of the corpus luteum. Okay. So what's again your take home message at this point is that this decrease in progesterone is a triggering factor for the prolactin increase. Okay. So that means there is an inverse relationship between progesterone and prolactin. Okay. So now this prolactin is increasing and it is responsible for maintenance of the corpus luteum. Now at the time of parturition, when there is going to be a drop, prepartum drop in progesterone because of regression of the corpus luteum, what happens? Because of the inverse relationship, there is again going to be a prolactin which is going to shoot up. Okay, it shoots up, and this prolactin is responsible for mammary gland enlargement, milk secretions, and nesting behavior. Okay, now after parturition, the prolactin drops again, and then it starts once again, it begins to increase as a response to suckling. Okay. So two important points you need to remember. There is an inverse relationship between progesterone and prolactin. The decline as a progesterone is the one that triggers the increase in prolactin. So if I'm going to treat a case of pseudopregnancy, I can actually go for antiprogestins. Am I right? Logically, if I go for an anti-progestin, automatically prolactin level is going to go down. Okay. But unfortunately, when I'm going to go for anti-progestins, or if I'm going to affect the progesterone secretions, the problem is that the moment I'm going to withdraw the treatment, prolactin levels will go again. So this is again something which you need to remember. So what happens in a pseudo-pregnant dog? So what happens in a pseudo-pregnant dog? So you need to understand this. So I'm giving you a small example, and let's see how this works. So let's assume that I have 10 dogs in heat. Okay, I'm going to breed 5 dogs, and I don't breed 5 dogs. Okay, now all these 5 dogs, they're not pregnant, so automatically they enter into the diestrous stage of the cycle. Okay, now these 5 dogs, I breed them. Out of these 5, 3 are pregnant, 2 are non-pregnant. So totally how many non-pregnant dogs I have? I have 7 non-pregnant dogs, which are non-pregnant, which are in the diestrous stage of the cycle. I call all these non-pregnant dogs as pseudo-pregnant. Okay. Now they are referred to as pseudo-pregnant, but all these 7 dogs do not come to you with signs of pseudo-pregnancy. Okay. Now this is what is very peculiar. I have all the non-pregnant dogs which are in the diestrous stage of the cycle. I call them as pseudo-pregnant. Okay. But all these dogs don't come to you with signs of pseudo-pregnancy. Okay. Now this is because you need to clearly understand that similarly around day 30, when there is an increase in prolactin, this prolactin in a non-pregnant dog is also required for maintenance of the corpus luteum. But at the end of the diestress, when there is a drop in progesterone because of aging of the CL or regression of the CL because of aging, there is going to be once again an increase in prolactin. Now, this is going to happen in all the 7 dogs which you're having. All the 7 dogs which are non-pregnant will have an increase in prolactin at the end of the diestress period. But what happens is all the 7 dogs do not come to you with pseudo-pregnancy. Okay, those dogs which have a higher level of prolactin, or they are more sensitive to the prolactin that is being synthesized, those dogs will come to you with signs of clinical pseudopregnancy. So very clearly understand, clinical pseudopregnancy is because of an increased sensitivity to prolactin or a higher level of prolactin brought about by a sudden withdrawal of progesterone. So this progesterone can be endogenous progesterone. That means there is a regression of the CL. That's why prolactin is increasing. Or I'm exogenously administering progesterone, withdrawing it off. Or I'm regressing the corpus luteum, progesterone is withdrawn. So in any ways, there could be an increase in prolactin secretion. Okay. So please remember, I would do this, but it again, the sensitivity to prolactin or a higher level of prolactin is the causative factor for pseudopregnancy. Okay, so common clinical signs are this, of course, I can skip: nesting behavior, overaffection, protectiveness, aggressiveness, mammary enlargement, weight gain, anorexia, all this is there. Less common signs would be emesis, abdominal enlargement, contractions, diarrhea, all this is going to be there, right? Okay, so the most important thing, again, please important, you need to do a differential diagnosis with pregnancy, right? So don't assume, simply don't ever assume that the dog is non-pregnant, it has, it's a case of pseudo-pregnancy. Always do a differential for pregnancy and pyometra, which happens around the same time, right? Okay. And so treatment involves basically conservative therapy. No, there is no need for you to generally treat the case because it's a self-limiting condition, okay? Usually it will resolve by itself. No treatment is required, right? And sometimes you find that if the mammary gland, mild hypertrophy of the mammary gland is there, or if the milk secretions are constantly there and the dog is continuously licking the mammary gland, that means you can go for e-collars, okay? You need to please educate your owner that he needs to avoid milking or compressing. Use of compress or stripping the gland should be totally avoided, okay? And you can actually withdraw the food or water for 5 to 7 consecutive nights. That helps in reducing the, even feed intake reduction will help in reducing the milk secretions. Now, more aggressive therapy involves the use of drugs. So as I told you, since prolactin, increased sensitivity to prolactin or a higher level of prolactin is important, is a causative factor, your choice of treatment involves anti-prolactin drugs, okay? So don't go for bromocriptine, forget about bromocriptine. Your best drug of choice again here is going to be gabagoline. Gabagoline administered at 5 microgram per kg once a day, okay? So please remember, initially it was, when I used MTP protocols, it always twice a day. But when it comes to pseudo-pregnancy, I'm going to go for once a day. Usually a lot of literatures go say 5 days, right? But I prefer to go for a period of 10 days. So administer for a period of 10 days. 100% it's effective. Okay.
Hatvet Pharma Private Limited is a pharmaceutical company with its head office at Meerut. It was founded on 29 January 2019 with a vision to provide affordable and quality veterinary medicine to our pet parents. Hatvet Pharma is doing marketing of veterinary pharmaceuticals throughout India. In a small span of 1 year, we have launched 51 products in the veterinary pharma industry to serve our clients. In future 1 year, we are planning to have a product basket of more than 100 products. Hatvet is different from other veterinary pharma companies as we don't have distribution channel. We understand the latest needs of market, and for this reason we have adapted to online module of selling our drugs to field practitioners. We are serving our clients by providing the required medicines at their doorstep without any middleman. We directly collect orders online, mobile app, WhatsApp, telephonic from our end customers, and we deliver the required products to their doorstep through our nationwide logistic partners Blue Dart, DTDC, TCI Express. We are happy to announce that in our client list, most of the leading pet practitioners of India are included. To assure the unbreakable faith of our clients in our company products, we look after the quality of products, starting from selecting the raw material for our final products, aseptic precautions during manufacturing, and proper storage of finished products till supply to the end customers to ensure quality of products. We are happy to share that Hatvet Pharma has been recognized at various business platforms. Recently, an article on Hatvet Pharma has been published in the leading business magazine Business Connect. One more milestone in the success story for Hatvet Pharma is that the managing director of the company, Dr. Rajneesh Tyagi, has been awarded Young Asian Entrepreneurs Award at Bangkok, Thailand on 7 February 2020. Our vision states Hatvet Pharma to be a commercially viable leading veterinary pharmaceutical company in providing quality products affordable to various sections of the pet owners society. Our endeavor is to be a front runner in innovation and quality in the veterinary pharma industry. We see a very bright future for our company as we are working in pet industry, which itself is growing at a higher rate, approximate growth of 20% annually. We are regularly working on the knowing of needs of our customers to serve them in a better way. We value your support to Hatvet Pharma and are very thankful to all of you. We look forward for a very strong and long business association between veterinarians and Hatvet Pharma. Thank you.